in the Upper East region, Radio Sangmala in the Upper West region, Radio Max in the Western region. Coming up, Ghana records 217 new COVID-19 cases, bringing total case count to 6,486 with 1,951 recoveries. We have details. Meanwhile, 13 health personnel in the Eastern region test positive for COVID-19. One is said to be in critical condition.
Apart from one who was very ill, whom we took to University of Ghana Medical Center, all the others are asymptomatic and ambulant, and we are supporting them the best way we can.
Also this morning, we are in Kumasi, where some persons with the disease have been attempting to break out of an isolation center there.
They tried to use a bear trolley to break the door, but they couldn't come out. Even though the door was broken in sections, they couldn't come out.
In business, Private Enterprise Federation warns of more layoffs as financial situation of businesses worsens because of COVID-19. We've got more in 15 minutes.
And parts of the country plunge into darkness for several hours. We'll hear from the Ghana Grid Company, which says it is working to resolve the problem. We begin from here, and Ghana has recorded 217 new cases of the novel coronavirus, bringing the number of confirmed cases to 6,486. According to the website of the Ghana Health Service, recoveries have also climbed to 1,951, indicating a rise of 53 from the last update. The number of deaths remain at 31. Meanwhile, in the Eastern region, 13 health workers have tested positive for COVID-19. Eastern Regional Health Director of the Ghana Health Service, Dr. Alberta Brichum Nyako, revealed one of the 13 infected persons is in critical condition and has been referred to the University of Ghana Medical Center for treatment.
In recent times, we are getting more cases amongst healthcare workers, which is alarming. And it is not just because they are nursing patients, but it's also because they are members of the community. So I must sound a caution to everybody that all of us are at risk. Apart from one who was very ill, whom we took to University of Ghana Medical Center, all the others are asymptomatic.
You hear the Eastern Regional Health Director of the Ghana Health Service, Dr. Alberta Brichum Nyako. Well, let's go to the Ashanti region now, where some persons with the virus in an isolation center have attempted to break out of a facility. The Kumasi South Hospital, which is the Ashanti region's holding center, witnessed 2 attempts as patients continue to pile pressure on health officials to let them out. Nanaya Ojima has more in the following report.
Kumasi Infectious Disease Treatment Center and the hospital's maternity ward are dedicated for care for COVID-19 patients. Out of about 30 patients admitted here since the outbreak, 18 have been discharged. Authorities are suddenly confronted with some of them secretly planning to leave the center on their blind side. 2 male patients who attempted to escape gave no reasons for their action. Dr. Angela Drowa Frimpong is COVID-19 case management coordinator at the center.
They tried to use a bear trolley to break the door, but they couldn't come out. Even though the door was broken in sections, they couldn't come out. Sometimes you can understand where their psyche is because you are being kept in a place for a week, 2 weeks, not your usual environment. You don't have the freedom to go out, so it can become a bit stifling.
Any unfortunate incident of a breakout here puts hundreds of people outside at risk, as admissions soar in the wake of increasing case counts. It comes with pressure on personal protective equipment here at the facility. From Kumasi for Joy News, Nanaya Ojima reporting.
And in the Volta region, the whole municipal hospital has suspended operations at its accident and emergency unit as well as the outpatients department after 2 patients tested positive for COVID-19 there. This is to make way for the disinfection exercise at the 2 departments to prevent a possible spread of the virus. Let's go on the line now and speak to the Volta Regional Deputy Director of the Ghana Health Services in charge of public health, Dr. Kwesi Jokoto. Hello, sir. Thank you for joining us. How long will these units be shut for, and how have any of the health officials there been tested yet?
Thank you very much. Just like all other hospitals, the whole municipal hospital has its surveillance, health facility-based surveillance system intact. So as a result, they continue to suspect cases. And over the past 72 hours, they confirmed 2 cases, one being a staff. As a result of that, the emergency department and the OPD had to be closed down and disinfected. All the staff who have any remote exposure have also been screened and tested. And this exercise is supposed to take about 24 hours. So all things being equal, ceteris paribus today, we should have the emergency and the OPD services back in full operation in the whole municipal hospital.
Thank you very much. You heard there Dr. Kwesi Jokoto. He is the Deputy Director of the Ghana Health Service in charge of public health and the Volta region, speaking to us there. You're also listening to the news at 6 here with me, Komla Adam. Let's move away from corona, or let's stay with corona a while longer, because losing a loved one can be very traumatizing, and in the wake of the coronavirus pandemic, the grieving process can be much more difficult for bereaved families. Now, the ban on social gatherings like funerals still remains in force. Joy News' Beryl Ernestina Richter looks at the trend of funerals among the Ga people.
Family and friends mourn the loss of their loved one, Rosamond Makudowona. They wail and burst into dirges as the remains of their loved one lies in state at the Cornelius Adumwa Dowona Way in Osu. There are no comforting hugs or handshakes. As the people mourn, they are also mindful of contracting the virus. An elder of the family, Jonathan Norte Dowona, explains they decided to strictly abide by the restrictions on social gathering, even during the planning of the burial and funeral of their deceased relative.
It was decided at the pre-burial meeting on 28 April to abide by the President's directive. We only allowed them to briefly extend their condolences to the family.
You heard there Beryl Ernestina Richter's report. Let's move away from COVID-related stories. And parts of Accra will last night plunge into darkness. The blackout saw affected residents from the Greater Accra, Western Ashanti and Central regions taking to social media to vent. And my colleague Mamiesi Mr. Thompson has been gleaning some of the outbursts on social media. Mamiesi.
Yes, Kamla. So this is from Mr. Law. He's saying, this light out be nationwide, I think. ECG, we beg. Then another one from Kelly who says, Doomso by this time. He made a post at 11:56 p.m. Another one from Adike says, light out, so annoying. No announcement to show something like the light out. No announcement to show something like the light will go off. I think we need to get a day for the government every month so they use that day for Doomso. No lights the whole of that day. This one from Bossy.
Okay, now the Ghana Grid Company we know has been reacting to this. What have they been saying? So
the Ghana Grid Company says they're fixing the challenge that caused the outages in many areas. And so some areas, however, are already back online. The general situation, they say, will improve soon.
Thank you very much, my colleague Mamiesi Nyamiche Thompson there. Now, Chairman of Parliament's Education Committee, William Kwetu, is daring teacher unions protesting plans to decentralize basic education under the Pre-Tertiary Education Bill to go to court. The teachers and the minority have raised red flags about the bill, insisting the plan to divulge authority to manage schools to regional and district assemblies will be bad for the education sector. The Education Minister yesterday directed the deletion of the portion of the bill. William Kwetu says the teachers should go to court if they're against the principle of decentralization because it's been law for many years.
Sectors that have been decentralized are education, health, the local governments have done long ago, and then agri. So it's already there. All the provisions are there in the Local Government Act. Okay. So decentralizing the basic education in Ghana is already in an enactment in the Local Government Bill. So there's no point bringing it in there, except that it's not as detailed as the Pre-Tertiary Bill, that is the Education Bill, wanted to do. So we'll go ahead and implement what is in the Local Government Act as it is.
So that if they want to challenge this, the teacher unions, they should probably
have to go to court. It's already a law, so they have to go to court and challenge it.
You heard the Chairman of Parliament's Education Committee, William Kwetu. That will be our package for today. But before we go, Ghana records 217 new COVID-19 cases, bringing total case count to 6,486 with 1,951 recoveries. Meanwhile, parts of the country plunged into darkness for several hours. We heard from the Ghana Grid Company, and then the Electricity Company of Ghana says power has been restored to the affected areas. There's more news when you log on to myjoyonline.com. But former Musaga President Bice Osei-Kuffour, alias Obo, has a road safety campaign message for us all today. Have a great day.
I want to back no friends here. Dikayanya party. Osme back will be embra. Jinaho, the Wasudi next year. A Kuninin penny nifu, I watch the one. Gloria Pesia, Cassidina Daburma. A doctor for me and Sat Wakoya Wama. Honorable Minister Wakoya Wankra. Apati, Akata, Susan Bonchaka. Enti yet now, I'm away at the end them. Yet now, Apostle Triumph. The man Mami Akra ne ma se wo kwaba Akra kuma se kwaya driver for what TJ trim tram matriculate break ate ensuo so ato ama na pa ben